Hi everyone, this is my capstone project, Occupational Therapy Assessment Tool for adults experiencing chronic homelessness. This project was created in collaboration with my mentor, Dr. Sharma, as well as occupational therapist, Dr. Rachel Kent, over at Healthcare in Action. Healthcare in Action is a medical group that serves patients experiencing homelessness through an innovative street medicine approach by contracting with Medicare and Medicaid, as well as hospitals and other health systems. So with this population in mind, I designed my project to focus on addressing a gap or need in occupational therapy practice when it comes to serving this population. And after conducting a literature review, I found that there are no assessment tools specifically designed for individuals experiencing homelessness. I also found that this discrepancy has resulted in difficulty assessing occupational performance in key areas, less advocacy for serving this population, and has created barriers in designing interventions that address individual priorities. So, what do occupational therapists currently utilize? So, common assessments include the COPM, the ACLS, and the KELS, as well as many other different screening tools. Most recently, students from USC created the Housed Beds Protocol, which is a clinical tool for taking a history on unsheltered homeless patients. So what I will do with my project is take inspiration and special considerations from these assessments in creating my own tool for OTs to utilize when working with this population. From the literature review, I found that approximately 20 to 25% of the homeless population in the US has been classified as chronically homeless. Chronic homelessness is defined as when an individual or household experiences long-term homelessness for 1 year or longer and often involves recurrent episodes of homelessness over time. These individuals may face significant barriers to obtaining and maintaining stable housing, such as mental illness, substance abuse disorders, disabilities, and other complex challenges. I also found that higher cognitive and social functioning support higher quality communication and interaction skills, resulting in increased working hours and higher income for adults with serious mental illness. An estimated 20 to 25% of the US homeless population suffers from serious mental illness. So, interventions addressing cognition and social functioning may support skills necessary for employment, which may be overlooked if not for an assessment tool that guides that specific intervention strategy. There is also a lack of attention to employment and interventions developed by OTs for individuals making the transition to housing, which further illustrates the need for this assessment tool to direct therapists to think about these key areas. The individual placement and support model, or the IPS, also supports the notion that employment is treatment and leads to improved recovery outcomes with individuals who have serious mental illness. So essentially, if OTs can successfully assist these individuals in gaining and maintaining employment, the employment itself will act as a therapeutic intervention and improve their outcomes. Social skills training and supported employment also demonstrate the strongest evidence for community reintegration and in the acquisition of normative life roles for people with serious mental illness as well. I also found that some individuals experiencing homelessness report that they relearn independent living skills on their own in a short period of time, but feel that they lose their ability to perform complex activities associated with being housed. These activities include home management, financial management, healthcare management, safety management, and so on. So what this means for my assessment tool is that it will focus more so on the skills associated with maintaining housing. Individuals experiencing homelessness also report that they lack opportunities to participate in meaningful activity, resulting in profound boredom and diminished mental health and motivation. So often with these individuals, they feel that they do not have any meaningful occupations in their daily lives or have lost those meaningful occupations and therefore do not have the desire to participate in activities within their community. So what is the prevalence or necessity of working with this population? Well, in Los Angeles County alone, the number of homeless people over the age of 55 is expected to grow from over 20,000 in 2011 to over 36,000 by 2025. 57 to 90% is the estimated unemployment rate for individuals experiencing homelessness in America. Approximately 600,000 individuals are currently experiencing homelessness in America, over 180,000 of which is right here in California alone, accounting for 28% of the nation's homeless population. There are more than 150 million homeless individuals worldwide and 1.6 billion with inadequate housing. So, my main takeaway for this project is that I want to advance the profession and involve the occupational therapists working with individuals experiencing homelessness. I want to empower general OTs with knowledge and confidence and create direction and discussion for future research in a rapidly evolving field. I want to gain insight and firsthand experience into the root causes of homelessness and mental illness and utilize the skills I have developed to make positive change in people's lives and determine which evaluation methods best align with the needs of individuals experiencing homelessness, and also reduce the stigma of working with this population. So to summarize my project, the participants in my project are adults, meaning those over the age of 18 who are living in shelters and are experiencing chronic homelessness. In other words, residing in emergency shelters, transitional housing programs, or safe havens for more than 1 year. My intervention will be creating a population-specific assessment tool designed to promote evidence-based practice in this emerging area. In my data collection, I will document observed changes in practice and the outcomes, hopefully for future research to determine the efficacy of this assessment tool later on. From my results, I will create pie charts and comparative bar graphs to be utilized to demonstrate change in participant outcomes. And finally, the impact to occupational therapy. Again, I want to advance the profession and evolve the way occupational therapists work with individuals experiencing homelessness. I want to actively address occupational injustices by advocating for a more inclusive society that provides equal opportunities and access to healthcare services for these individuals. And I want to develop the practice of occupational therapy, provide general practitioners with knowledge and confidence, and create direction for future research so we can better the practice of occupational therapy. And that is my capstone project. Thank you.